Hi and welcome. My name is Dawn and I'm a student at the University of Montana, and I want to thank you for responding to our flyer. Our group put together a webinar about the Affordable Care Act, ACA, or Obamacare. We are here today as college students in an effort to reach out and educate other college students on what students need to know about the ACA. There's a lot of misinformation out there, and we would like to help clear up some of those political discourses and tell you what you need to know and how it will affect you. Today we will be talking about the following: the new law. We will discuss incentives, penalties, and exemptions. We will talk about college campus surveys that were performed, and then we will take your questions. So let us begin by turning this over to Bud, and he will be discussing incentives, penalties, and exemptions.
Hi, my name is Bud. My part of this project is going to be on the penalties / incentives and exemptions. If you can afford health insurance but do not buy it, you must pay a fee, which is known as the individual shared responsibility payment. Other names are penalty, fine, or individual mandate. An important notice about the healthcare signups is that the marketplace open enrollment ended March 31st. You can now buy a marketplace health insurance only if you qualify for a special enrollment period. This special enrollment period generally allows you to qualify for a special enrollment period of 60 days following certain life events that involve a change in the family status, such as marriage, birth of a child, or loss of health insurance coverage, etc. Now, the fee for the 2014 and beyond are as follows. The penalty will be calculated in one of two ways. Remember, this will be whichever is higher. So for 2014, you will pay 1% of your yearly income. This amount will only apply to the income above the tax filing threshold, which is $10,150 for an individual, and this is used to calculate the ACA penalty. The second is $95 per person for the year. It's $47.50 per child under 18 years of age. The maximum penalty per family using this method is $285. The way this penalty will be calculated is a single adult with yearly income below $19,650 will pay the $95 flat rate. A single adult with yearly income above $19,650 would pay the 1% rate. If your yearly income is below $10,150, no penalty will be owed. This penalty will increase every year after 2014. For 2015, the penalties would be 2% of your yearly income, or $325 per person, and for children under 18, this amount would be $162.50. In 2016 and later, for now, it will be 2.5% of your yearly income, or $695 per person. Children under 18 would be $347.50. You need to be aware that if you are opting to pay the penalties, this does not mean you are covered by the insurance. The minimum essential coverage is considered as any marketplace plan or any individual plan you already have, any employer plan, to include COBRA. These do include retirement plans, also Medicare and Medicaid, Children's Health Insurance Program, which is CHIP, TRICARE. This will be for current service members and military retirees, their families, and survivors. Veterans health care programs like Veterans Health Care Program, VA Civilian Health and Medical Programs, which is CHAMP VA, and Spina Bifida Healthcare Benefits Program, Peace Corps volunteer plans, self-funded healthcare offered to students by universities at the beginning or before December 31st, 2014. Now for your exemptions, they are for people with limited incomes and other situations can be exemptions from the fee. You may qualify for an exemption if you're uninsured for less than 3 months of the year, the lowest priced coverage to you could be more than 8% of your household income, if you don't have to file tax returns because your income is too low, you're a member of a federally recognized tribe or eligible for service through an Indian health service provider, you're a member of a recognized healthcare sharing ministry, you're a member of a recognized religious sect with religious objections to insurance, including Social Security and Medicare, you're not lawfully present in the United States, hardships, for this, you would need to see healthcare.gov for these exemptions. Also, gaining citizenship and leaving incarceration. For more information on what I have talked about, you can go to healthcare.gov.
Hi, my name is Patty, and I am a social work student at the University of Montana. Recently, I've had the pleasure of going to the local Flathead Valley Community College in Kalispell, Montana, and doing a survey with 20 college students. And during this survey, I was able to gather some data with regards to healthcare insurance. And so part of that data that I gathered was out of the 20 students that I surveyed, a majority of them were between the ages of 18 and 32 years old. And part of that data was asking how many of them had healthcare insurance. And only 11 of the 20 had healthcare insurance, which means 8 did not have insurance. Another part of the data that was collected was asking how many were covered under their parents' plan. 8 of them were covered under parents' plans, 3 were covered under their own. Another piece of data that we collected was asking how many of them were aware of the subsidies available through the Affordable Health Care Act, and only 7 out of the 20 were aware. And then the last piece of data that we collected was asking if they were aware of the penalties that were of not having health care insurance, and 16 of them said yes, they were aware. And so we also asked them to ask a question that they may have about the Affordable Health Care Act. And so Michael is going to try to answer some of those questions through a Q&A. And so I'll turn it over to Michael. And before I do, I just want to thank those students at Flathead Valley Community College for taking the time to complete the survey and being a part of our group. Thanks, and all right, here's Michael.
Hi, my name is Mike with the University of Montana, and appreciate you joining us for our webinar. We interviewed approximately 40 college students on 2 Montana University campuses, and these were the top 9 questions that we had. Number 1, Why are all healthcare plans so expensive? Well, for healthcare to work the way it's supposed to work, there has to be an equal number of healthy versus unhealthy people sign up for the insurance programs and plans. Without the balance, there'll be a shortfall of funds. And with the shortfall of these funds, taxes and or premiums could rise to cover the extra expenses. Another question that was brought to us through our interviews with students on the college campuses: how long after being removed from my parents' plan do I have to get coverage? Well, the age to be removed from your mother and father's plan is the age of 26. So one of the recommendations that we'd like to recommend to you is that if you're, let's say you're the age 25, you should probably begin to research, find out when the next enrollment deadline is, and begin to research your options. Find out what you can financially afford according to your own personal budget, so that when the next enrollment opportunity becomes available, then you'll be ready to go. You'll have your information, you'll know what plan you can afford, and then you can go through the process of signing up. Question number 3. Will the penalty be the same each year if I don't get insurance? Well, the answer to that question is no. For 2014, there will be a flat fee, as one of our university students already explained. Bud explained about the different penalties and the cost. There'll be the flat fee, and in 2014, the interest will be 1% of your income, whichever is greater. When you get to 2015, it's that flat fee, or 2% of your income, whichever is greater. In 2016, it'll be the flat fee, or 2.5% of your income, which is ever greater. 2017 is an unknown, and until we get closer and they reveal the figures, and there are a lot of variables, could be inflation, taxes, and different things. And so let's move on to question 4. Question 4 is, how do I know which plan I need? That's a really good question. It's based upon how much you can afford. There are 4 different plans. They're called the metal plans. There's the bronze plan, which has the least costly premium. Then you have the silver plan, the gold plan, and the platinum plan. And it all depends on what your income is and what you think you can afford as a monthly premium. For the bronze plan, it's a 60-40 payment. The insurance provider, whoever you decide to go with, or whichever plan you decide to go with, will pay 60%, and you will pay 40%. And then, of course, the silver is 70-30, the gold is 80-20, and the platinum is 90-10. And each time you go up, say you go from the bronze to the silver, your premium will increase. If you go from the silver to the gold, again, your premium will be a little bit higher. And then, of course, if you move from the gold to the platinum, again, the cost will be a little bit more higher. Gives you a little more, gives you more access to more options available, the higher the premium that you pay. And so let's move on to question 5. Where can I go to sign up now that open enrollment is over? And that's a really good question. You need to go online to healthcare.gov, and there on that website, they will give you some options if you missed the deadline. There will also be phone numbers that you can access to talk to a live person. They'll direct you to private insurance companies now, and then they can possibly give you when the next enrollment period is, so you can be ready, be researched, and be ready to go. But just at the end of our broadcast, or here shortly, one of our students, one of our group members, will be giving a number that you can call. She'll be going through how to sign up, where to go, and give you complete information. Question number 6. Will Obamacare affect what doctor, and will we be able to choose our doctor? Great questions. And these questions are all dependent upon your insurance company and the insurance provider and their preferred providers. So let's say you have a doctor that you prefer. You will need to research and find out what network your doctor works through. Each company each insurance company will have a list of preferred providers, people, doctors that you can go to find the services that you need to access. And so what you need to do is upon signing up, look and see if the doctor you prefer is in that preferred provider list. Question number 7. How will I know where I can be treated if I get sick or injured? First of all, if it's an emergency, you can go to your local hospital and their emergency room. They will provide care and service for you. They can't turn anyone away. And so if it's an emergency, you can go to the regular hospital emergency room. Again, if it's not an emergency and you need to make an appointment with the doctor or see a doctor about an issue that you're having health-wise, you need to again go to your insurance provider and look on their preferred network and see which doctors you can access to get the treatments and services that you need. Question number 8. What is a subsidy and how do they work? Excellent question. This is one of the biggest topics that people do not understand when it comes to the healthcare exchanges and signing up. Many of them, when you look at those first numbers, it's extreme pressure, like how in the world am I going to come up with that kind of money? And they don't understand the incentives due to there's not enough education and awareness. And that's one of the reasons we're trying to answer through this question and answer time, so that you have a little bit more knowledge and understanding how the subsidies work. Let me give you a few definitions of what a subsidy is. A healthcare subsidy is financial assistance from the government that you could be eligible for to help you pay for health insurance. Your eligibility is generally determined by your household income and family size. To see if you're eligible for a subsidy, there are several different places online that you can go to and just type in subsidy calculator, and they'll take you one that is a really good one that you can access is through TurboTax. TurboTax, it has it's called the Tax Break, the TurboTax blog. It'll give you a definition of what a subsidy is. It'll give you some information that you can access if you need more. So that's what a subsidy is. It is a supplemental help through the government based on your income and your size of your family. So how does a subsidy work for you? Well, you can apply for your subsidy when you purchase health insurance through online federal or state healthcare markets. The name of the online healthcare marketplaces are different in each state. So for instance, if you're in Montana, you need to go to your Health and Human Service website to find out where you need to go for the exchanges for Montana. And if you're in California or another state, you can access those through your Health and Human Service web lines. Well, another question is, people want to know, well, how do the subsidies work? And that's an excellent question. The subsidies will go directly to your healthcare insurance provider when you purchase insurance to lower your monthly health insurance payments or your premiums. So let me give you an example. I went online and I typed in my family. There's 2 of us, my wife and myself. We're non-smokers. We typed in our annual income. All of our children are grown, so we have no dependents. And so after I typed all of my information in and what state I was in, it'll ask you for your zip code. Then it came up with an approximation, not an exact, but an approximation of what I might pay. Now I'm going to use generic figures. I think mine and my wife's monthly or yearly premium came to a little over $7,000. So we'll just use $7,000 as a flat figure. Well, when you divide $7,000 divided by 12, you come up with a premium monthly amount of $583. And that sounds high, and for a lot of folks it is, and that's just for 2 of us. But where the mistake comes in, a lot of people fail to understand that they may qualify for government subsidies. And so although the price of your monthly premium may say $7,000, then based on your income it says you could be eligible for a subsidy. I think it was right at $4,000, maybe a little bit over when I put in my wife and I's information, and it came up with 4,000. So we'll generically say round it off at 4,000. So the initial number was 7,000, but then when you subtract the possible subsidies you might get, so 4,000 from 7,000 leaves 3,000. You divide that by 12, it comes up for about $250 a month. So in the beginning, it looked like I was going to pay $583 a month premiums each month, but after I found out what possible subsidies I could be eligible for, it reduced my monthly premium from 583 down to 250. Pretty significant, almost in half, or a little over half. And so that just gives you a little bit of an example how the subsidies might help, and how you find out what you qualify or could be eligible for is to go on and find a subsidy calculator. Kaiser Permanente has it, TurboTax has it, and you can check through some of those to find out what you might qualify for. Question number 9. Why is dental not covered in a minimal plan? Well, in most healthcare coverage plans, dental is kind of like an optional extra thing you can add onto it, dental and vision. And so usually for many dental and vision programs, you have to pay an extra amount or another, it could be $70 to $100 a month more for a dental plan, maybe $30 or $40 more a month for a vision plan. But usually for healthcare plans, it doesn't include dental and vision. Those are optional things that you can add on for an additional charge. And so you might want to, as you're researching, you might want to look and see if those options are available to you and how much, and dependent upon your monthly economic situation, whether you can afford it or not, you'll have to make that choice. And so, can you believe that? We went through all of the questions, and thank you for spending time with us, watching our webinar. If you do have more questions or you have things that haven't been answered, one of our team members, Lacey, is going to be coming on next and explaining where you go to sign up, give you a 1-800 number of who you could call. And thank you for your time, and hope you have a great day.
Hello, I'm Lacey Boggs. I'm a social work student at the University of Montana. I'm going to be explaining how to sign up for healthcare online and giving some other information on helpful websites for getting health coverage. Open enrollment for this year has ended, but it will reopen November 15th and remain open until February 15th of 2015. Currently, there are still options for getting a marketplace coverage if you have had a qualifying life event. These events may include marriage or the birth of a child after April 1st. To find out if you qualify for the extension to get a marketplace coverage, contact the Marketplace Call Center at 1-855-889-4325. Another way to find out if you qualify is to go to TurboTax Health. This site will ask for your age, marital status, zip code, and yearly income. Next, it will ask if you have had a qualifying life event. If you have not, then the site will give you the penalty fee that you will need to pay at next year's tax. Next, the site will tell you ways you might be able to qualify for an exemption on the penalty fees. This would include if you are unable to afford a marketplace plan. Then the site will give you a list of possible short-term coverage plans, and the prices for those plans will depend on your individual life circumstance. If you do qualify have a qualifying life event, TurboTax Health will give you information on qualifying for a possible discount on coverage plans. The site will give you the amount of money you will get off of a monthly premium, and it will tell you what plans will cost with the discount you qualify for. When signing up for health coverage, you go to healthcare.gov. Once you're there, you'll select your state of residence and then create an account. This will require you create a username and a password, and that you select 3 security questions. There are several different plans available, And when you select coverage that you want, you will be given different options for each plan. These plans range from a bronze plan that will have several different price options. The bronze plans are the low cost with low premiums. Then it ranges up to a platinum plan, which is the most expensive plan and has the highest premium. There's also a catastrophic plan, which is offered to those under the age of 30. This plan has a higher deductible with lower monthly premiums. The healthcare.gov website has been having some technical difficulties. The easiest way to get help finding the best plan for you is to call the Marketplace call center. Again, that number is 1-855-889-4325. There are people available 24 hours a day, 7 days a week to help you with any questions you have on signing up.